Hi, it's nice to see you. Could you please tell us who you are?
My name is Sharon Fonn. I am a professor of public health at the University of the Witwatersrand here in Johannesburg, and had the privilege, in fact, of being a Fulbright scholar with you at the University of Southern California in your institute.
COVID hit actually while you were here with us. So I wondered if you could say a little bit about how COVID has affected you personally.
Firstly, it interrupted my work. In fact, the day I was supposed to give a presentation at the center, it was cancelled. The university was closed, and then had to find a way to return home, and did manage that. Literally, the very last flight that was allowed to land before we closed the airports, and then returned to a very different country to the one that I left, in a lot of different ways, but obviously the emptiness was what struck you most, and a very peculiar impact. South Africa is a country which is known for both systematic but also arbitrary violence. There's a chance that you could be hijacked coming home. Suddenly, in a peculiar way, it was safer. There were curfews. What was happening, which is epidemic in South Africa and has only gotten worse during this period, is gender-based violence.
And that is something that you're aware of, which I guess moves to my next question was, how has COVID impacted your work? Is this something you're aware of through your work? Is this something that is giving a change of focus in terms of what it is that you're working on?
So it's impossible to be in South Africa at the moment and not to be aware of it. It's something that is taken up at every level in the media. The president talks about it. There have been statements like, why are South African men killing South African women? So it's something that's discussed in many forums. There are NGOs that are working on it. But what is interesting is how much it's part of the public discourse. And then the other side of it, of course, is that I'm not sure we have any solutions, and I don't think we've implemented any.
And do you think that COVID has brought more awareness of the violence that was already there? Or do you think that there'd be attention to the violence even if COVID had not happened?
No, I think that people are certainly aware of it. It's probably it's one of the characteristics that South Africa is unfortunately known for. COVID has absolutely exacerbated it, and it's certainly driven it to the front pages of newspapers or the headlines of radio. And one of the interesting things about South Africa is we had a ban on alcohol because of COVID. And it's one of those terrible questions. Are you more likely to beat your wife with or without alcohol? But I don't think that it's changed anything in relation to the levels of gender-based violence.
And what about when you think about the policies that South Africa has been putting into place, and I know there's been a variety of them in relationship to COVID, which are the policies that you think are most of concern? Which are the ones that you think are effective? If you could talk a little bit about at the policy level, how the country is responding.
So in the early days, there was almost a sense of excitement and hope, because right in the beginning, there were two things we saw. Really bold and confident and competent leadership from the president. He got up, he spoke with authority, he spoke in an informed manner, and he spoke in a way that made you feel that the decisions being made were based on science. So that was the one thing that we saw. The second thing that you saw was this health in all policies. Across the board response to the pandemic. In theory, and I suppose this is always the tragedy of South Africa, our policies are great and the talk was fantastic. The walk was not. So that was problematic. And then the other thing that was very quickly implemented was economic reforms to tide people over this period. So we already have quite a significant social safety net. And so people get childcare grants and a whole series of different grants. And those grants were increased in value for a period of 6 months. So as I said early on, there was some excitement. That has dulled and in fact turned to despair.
Do you think that things are improving? Do you think that things are getting worse? Kind of in the moment where we are now in August 2020, it's a question about kind of where are things going in that direction?
I think people are feeling not optimistic because some of the policies have not seemed to be science-based. There's been increasing cynicism in relation to what the government has done. And right now, there is a belief that the government is doctoring the statistics and putting out false statistics so that they can open up the economy, because it is true that the closed economy is having an enormous social impact. There are two things I think that COVID have illustrated internationally. And it's very visible in South Africa, the depths of inequality and the consequences of it. And of course, this isn't true of all people and all journalists, but I feel that people aren't conversant enough with data, how to report it, how to understand it, and how to communicate it. And this probably rests with us as the people who generate these data. You know, I often feel if people don't understand what we're saying, it's not because they're stupid. It's because we aren't communicating properly. And so at a very sort of high level, I think that's one of the lessons for us as researchers and academics, is we need to speak well. We need to speak accurately. We need to speak carefully so that people do understand us.
My last question for you, you just started to touch on, which was really about kind of key lessons that we can take from the pandemic. And the first one that you gave is very much at a level of those of us as academics, as researchers. Can you speak a bit more broadly as well about, as a society, what you think may be some of the most important things we should take and learn from this?
So everyone speaks about the new normal. And I think that the worst case scenario is that the new normal is similar to the old normal. If we as a society can't own that and confront it and act collectively to do something about that, that would be the worst case scenario of the outcome of this pandemic. And I think it's about community action. I think where we've seen government here fail, it's succeeded in some ways, but where we've seen it fail, we've seen civil society step in. As much as the horrors of what you see, there are also enormously uplifting moments where people are making sure that when they cook extra and they'll feed people. People are contributing and distributing food. People are kinder to each other. People greet each other in the street. How do you keep that? But how do you organize to make that a structural change? And I think there's both a bottom-up and top-down responsibility. Civil society is not government, but it must hold government to account. And part of what we must learn out of this is the community-based organization that makes that possible.
Thank you. Thank you. I really appreciate you taking the time.